Hello, my name is Dr. Joseph Feuerstein. I'm a third-year Gastroenterology Fellow at Beth Deaconess in Boston, Massachusetts. I would like to discuss an article I authored with my colleagues that's being published in the Mayo Clinic Proceedings. The article is titled, Systematic Analysis Underlying the Quality of the Scientific Evidence and Conflicts of Interest in Interventional Medicine Subspecialty Guideline. I'd first like to thank my co-authors, Dr. Mona Akbari, Ann Gifford, Christine Hurley, Dr. Daniel Leffler, and Dr. Sunil Sheth, and Dr. Adam Chaffetz. Clinical practice guidelines are a critically important tool in assisting physicians in the practice of medicine. The Institute of Medicine defines a guideline as a systematically developed statement to assist practitioners in patient decisions about appropriate health care for specific clinical circumstances. Practice guidelines are meant to succinctly summarize the vast medical literature for the practicing clinicians to help keep everyone up to date with the most recent evidence. The guidelines are meant to improve the safety and overall quality of care. Insurance companies and organizations have used guidelines as a means to establish the standard of care. With an increasing focus on quality of care provided, physicians are being evaluated for their compliance with set quality measures. Insurance companies and the Center for Medicare and Medicaid Services have established incentives as well as penalties for failure to achieve these quality measures. As a result, it is critical that guidelines used to establish many of these quality measures be based on the most up-to-date evidence and developed in a manner free of any potential bias. Our group has already published articles evaluating the strength and quality of evidence used to formulate the International Inflammatory Bowel Disease Guidelines. We also recently published an article evaluating the strength and quality of evidence supporting gastroenterology guidelines. Unfortunately, in both cases, the quality of evidence was less than ideal. In medicine, multiple subspecialties, including cardiology, gastroenterology, nephrology, and pulmonary, all perform invasive procedures. Each of these societies have developed interventional specific societies as well. My co-authors and I therefore endeavored to evaluate the overall quality and strength of evidence supporting the guidelines used in the interventional medicine subspecialties. We hypothesized that given a potential increased risk with interventional procedures, clinicians may rely heavily on practice guidelines to ensure safe and quality care. We reviewed the societal websites of the American Society for Gastrointestinal Endoscopy, the American Association of Bronchology and Interventional Pulmonology, the American Society of Diagnostic and Interventional Nephrology, and the Society for Cardiovascular Angiography and Interventions. Since the American Association of Bronchology and Interventional Pulmonology did not publish guidelines on their websites, we reviewed the other two main pulmonary societies, the American College of Chest Physicians and the American Thoracic Society, for any interventional specific guidelines. All guidelines were reviewed to assess if they graded the level of evidence, and if they did, then what methods were used to grade the evidence. Additionally, all recommendations were reviewed and the grades of evidence used were tallied. Guidelines and societal websites were also reviewed for any disclosures regarding conflicts of interest among the guideline authors, and also if any of the guidelines had any planned update intervals to them. In total, we reviewed 153 guidelines. Only 46% of the guidelines graded the quality of evidence used for their recommendations. When looking at the level of evidence used to support the guidelines, 11% was supported by the highest quality evidence, level A evidence, supported by multiple randomized controlled trials. 42% were level B, and 48% were supported by level C evidence, which corresponds to case reports or expert opinion. On average, the guidelines were a little over 5 years old. 62% of the guidelines failed to provide any disclosures regarding potential conflicts of interest among the guideline authors. While guidelines are meant to create a safer system, our study highlights the importance of improving the system by which guidelines are developed. Many societies have adopted the grade system. The grade system is a system which can be utilized for any guideline development process, and it's very easily interpreted by a practicing clinician. The grade system grades the level of evidence used as either high, medium, low, or very low. It then provides a corresponding strength of the recommendation of strong or weak based on the certainty of the benefit of the recommendation that the authors are giving. This system allows the evidence to be graded based on the strength of the study and less focused on the number of randomized control trials present in the subject. We hope that you find our article interesting and that it is a source of discussion regarding how guidelines are formulated and how they are used. We feel it is critical that the process by which guidelines are developed be standardized with a system like the grade system, and that the whole process be transparent regarding any potential conflicts of interest. And lastly, it is critical that the guidelines are continually updated with any and all new evidence which is constantly being published. Thank you very much.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.